I chose to go into dentistry because as a child I had really good experiences going to the dentist, and I would hear other people say, even as adults, say how horrible their experiences had been and they didn't like going. So since I had always had a really good experience, I wanted to bring that to other people, and I thought I could do that through dentistry, whether it be when I was an assistant, as a hygienist, and now as a dental therapist as well. I chose to go on to dental therapy. Now I'm a certified advanced dental therapist. I chose to pursue that route because I just felt there was a huge need for more restorative care and the scope of practice that we can provide, given the limited access most of the patients have that we provide care for.
So I first learned about dental therapy my senior year of dental school. I'll admit my whole class went to the legislature when they were talking about, and we were opposed to it at the time because what we were led to believe was that it was going to be people who weren't going to be very well trained, who were going to be doing really complex procedures. I've since learned, and working with Kelly and Eva, that if anything, they free me up to do the dentistry I like to do. And so it's actually worked out, and I'm very grateful that we have dental therapists where I work.
My name's Ruth Malari. I'm a staff nurse here in the Coordinated Care and Hennepin Health Access Clinics. In general, we're trying to keep people out of the emergency room and as much as possible out of the hospital. Sometimes we have a patient come in and they say, oh, you know, my mouth is hurting really bad and I've got this swelling, and then we'll come and talk to them and see if they're able to see the patient or help us out. They're so flexible in working with us.
Advanced practice providers are very common here within the whole Hennepin healthcare system. There's a whole variety. There's nurse practitioners, there's physician assistants, there's nurse midwives, and we fit right into that model, and we provide the same type of scope of practice for patients throughout the system.
They've been very open and welcoming towards us, and you know, they rely on us as being their dental resource.
My name is Jake Dvorak. I work for Lakeland Dental. It's a group practice. We have 2 dentists here, and we have 2 dental therapists also. So communicating to our patients, it's pretty straightforward. Our hygienist usually will tell the patients, hey, you're being seen by our dental therapist, Jake. And that's usually when I come in and I'm introduced to the patient, and the patients don't really have an issue with that.
My name is Sherry Triff. I'm an advanced dental therapist and a licensed dental hygienist. I work for Lakeland Dental in Staples. I got into the dental field when I was young, just after high school. I helped my hometown dentist and went to dental hygiene school, and I practiced dental hygiene in my hometown in a rural community. And then I ended up going back to school for dental therapy.
I decided to hire a dental therapist about 3 years ago. We had 5 doctors in our 3-location practice, and we had 2 of them retire. And so I tried recruiting a dentist to this area. It was very difficult to find a good candidate to come to this area and put their roots down. And so I looked into dental therapy, and what we've done then is taken a 5-doctor practice and we've made it a 2-doctor practice with 2 dental therapists, and it has worked wonderfully.
My schedule is a 1-column schedule generally. I do a lot of fillings and help with that, and then also any toothaches that call in, we try to see them right away. I think the longer dental therapy is around, the more acceptance it will get. I just read there's 114 in Minnesota now, so it's gaining momentum and acceptance.
Apple Tree Dental is a nonprofit dental organization. We strive to see people that have difficulties finding a dental home. We do see a lot of state-funded insurances, but we do see all kinds of insurances and all self-pay patients. Everyone can come here.
I really didn't have much of an interest in dentistry until I was about 22 years old. And long story short is I became a dental hygienist first in 2002. And then eventually I got the chance to do restorative functions for Apple Tree, which is where a hygienist can do some expanded duties like place fillings. And so that was in 2006. And that just sort of led me down a path where I decided to go back to dental school and become a dental therapist, which I graduated in December of 2016.
We have a significant population who really need access to dental care. Either they couldn't find a dentist in their area who accepts their insurance, or they don't have any dentist in their area to serve them. So I think the dental therapists really fit into that really well, and dentists can carry out more complex procedures like surgical extractions and root canals. So it's pretty much like win-win situation, both for the organization and for the patients too.
Take your elbows, we're going to scooch you up. Ready? 1, 2, scooch. Down. Up here, right where you need to be. There you go.
It's very, very high need for dental therapists. We're able to let them do procedures that are very much needed in the dental setting, but they are at a level that isn't needed for a licensed dentist to do. So a dentist can do the surgical extractions, he can do a root canal, they can do the crown lengthening, all the denture steps, all the complex procedures that are needed to be done by a dentist. Therefore, we're able to shift all of the procedures that are under the duties of a dental therapist to their schedule and free up a lot of time in the dentist's schedule. We are also able to use them at outreach, which then is able to let us keep the doctors in the clinic. There's a lot of things at the outreach centers that we don't really need the dentist to do.
As far as a dental assistant working with a dental therapist, I feel like the relationship is much like a dentist. We're there to help them and help the patients through the procedure. It's nice to be able to help a dental therapist who's a fresh graduate be able to kind of help gain their confidence and be there for not only them but also the patients.
If you look at my schedule on an average day, I'm seeing probably 9 to 10 patients a day. And I would say probably 7 are restorative, maybe 1 or 2 exams, like limited exams. And so all the fillings that I do free up our dentists to do bigger procedures, and Dr. Gurapati's schedule has got more and more extractions, I think, since I came on board. And there's lots of people who need those extractions. We're still booked out several weeks for extractions. So yeah, I think it is a win-win situation, and I think the teamwork, is what really helps us be efficient.
I feel like our patients are grateful that we're here.
Hiring a dental therapist in a practice is a really good option.
Dental therapy is needed and should be used throughout the country. It is definitely an asset